During this presentation, we are going to cover information from Chapter 3 of the Torres Patient Care and Imaging Technology textbook. It is going to cover communicating for successful patient interactions. The objectives for Chapter 3 include identifying methods for determining the correct patient for a given procedure, determine how to collect information from the patient prior to an examination, describe how critical thinking skills must be used for effective communication, explain the problem-solving process in patient education, describe age, generation specific communication, interpret medical abbreviations and symbols, define medical imaging terms, define verbal and nonverbal communication, describe the challenges that affect communication, and define therapeutic communication and demonstrate its techniques. Communication is one of the most critical components of the patient care experience. Effective communication is paramount in the patient care process, serving as the radiographer's initial opportunity to establish rapport. Attitudes of both parties influence communication, with patients often experience diverse emotions that may impact their perception and reception of information. Radiographers who grasp both patient and personal emotions can enhance their effectiveness and compassion in healthcare delivery. Patients anticipate radiographers to be attentive and articulate, prioritizing the patient's concerns over their own personal matters. The radiographer's first interaction with the patient should be verifying the identity of the patient. As a radiographer, you always want to make sure that you are going to image the correct patient and perform the correct procedure. This can be handled a little bit differently depending on if you're in an outpatient setting or an inpatient setting, but both are very similar. The radiographer must always ensure that the correct patient is present and the procedure has been explained adequately. There are two ways that you can verify your patient. In an inpatient setting, all patients are going to be given a wristband. You can verify the name, date of birth by looking at the wristband and also by verbally verifying it with the patient. In an outpatient setting, oftentimes patients do not wear a wristband, so you will just have to verify their name and date of birth verbally, and then you want to double check the order request, whether it's in an electronic patient chart or in a paper chart, but you want to verify that the correct patient and the correct exam are being performed. The next step in the process, after you have identified the correct patient and the appropriate procedure, would be explaining the procedure to the patient. It is important to consider that your patient that you are about to perform an X-ray on may not have ever had an X-ray performed before. So it's important to explain the procedure, the length of time, any devices that you're going to be using, immobilizers that are going to be used if you need to use them, as well as just comforting the patient. When patients come into the department, they can be scared, they can be uncomfortable. So your job is to explain everything that you are doing from start to finish to ensure that the patient knows exactly what is going on the entire time of the procedure. The objective of obtaining a patient history is to gather essential information for a safe and comfortable procedure. Often, this is partially completed by the patient's physician or nurse, but the radiographer must also be involved in the patient history process by directly questioning the patient about the procedure being ordered. It is important to establish a private, quiet atmosphere and build rapport with the patient prior to obtaining a history. A radiographer must always be respectful during this interaction, and patients should be informed about the purpose of the information being gathered. Both open and closed-ended questions are utilized to elicit relevant medical details. In the imaging department, certain key pieces of information must also be obtained. This includes the last menstrual period and possibility of pregnancy for female patients of childbearing age. This is done with cultural and age considerations in mind, and it's vital to confirm the imaging examination requested to ensure accuracy by verifying the correct side and body part with the requesting provider. When obtaining a patient history, some vital information that must always be included are the localization of the problem. So ask the patient, where is the area of pain? Why are you here today? What's going on? And establishing a timeline. So chronology is when or for how often has this been bothering? Is it acute or is it chronic? So acute means short term, chronic means long term. Also, the quality of the pain. How severe is the problem? Onset. When did this begin? Was it a motor vehicle accident? Did it just happen with no reasoning? Also, aggravating or alleviating factors. So what makes it feel better or what makes it feel worse? And lastly, associated manifestations. So what else happens during the pain episodes? A medical record is crucial for every patient seeking medical care, whether outpatient or inpatient, commencing upon arrival and continuing until discharge. It serves various purposes, including transmitting information among healthcare providers, safeguarding against errors, supporting research, protecting healthcare workers legally, and evaluating the quality of patient care. A typical patient record nowadays is in the form of an e-chart using some form of an electronic medical record system. Medical records contain extensive data such as patient demographics, physician's order, progress notes, medical history, diagnostic reports, discharge summaries. And radiographers should check these records before imaging procedures to ensure accurate patient information. It is important to review past reports for follow-up cases and assess any history of contrast allergies for relevant studies. Additionally, documentation by radiographers should also be a part of the patient's electronic healthcare records and chart, especially regarding contrast administration, patients' responses during imaging procedures. It is also crucial to adhere to proper documentation procedures and correcting errors and maintaining confidentiality. Diagnostic reports provide valuable insights for radiographers. Also, when you receive an order for an X-ray procedure, it must contain patient identifying information, such as name, date of birth, and medical record number, and all of this must be correct. What it is that is to be done, and also a pertinent history as to why you're performing that procedure. For example, it might say roll out fracture or neck pain, status post motor vehicle accident. A clinical indication should be on an order, but in some situation it is not. That's why it's always important for the technologist to obtain a separate patient history and clarify why the procedure is being performed. And certainly the name of the ordering physician will be on the order as well, and that will go on the electronic report. Before starting an examination, radiographers address any concerns or questions patients may have and ensure they understand the procedure fully. If needed, informed consent forms are properly signed and any patient refusals are promptly communicated to the physicians. Radiographers assess each patient's individual needs, taking into account factors like previous experience, demographics, health status, and learning style. After procedures, radiographers reinforce initial instructions to ensure patients remember and comply with follow-up care as required, helping to promote positive outcomes. Just like you explain to the patient before the exam, you need to give the patient any post-exam information as well. If patient has had contrast media, you definitely need to discuss what the patient should look out for in terms of potential adverse effects. Oftentimes, patients want to know how long it will take to get the results of the x-ray that you just performed. Give the patients a general idea. These images will be read by the radiologist, who will send a report to your doctor who ordered the study. In hospital settings, turnaround time is a lot quicker, but in an outpatient setting, it can typically take 24 to 48 hours. I would also give your doctor a few days to get the report and call him or her to find out what the results are. Healthcare members should learn about communicating with children at all levels of development, as this may improve delivery of care to the patient and the relationship with the parent. Just as with adults, listening is key to providing care for a child as well as the parent. Remember that the parent has the choice to take the child elsewhere for treatment or procedures. One would not use the same communication skills with a young child as you would with an adult. This does not mean the tone of your voice or speech pattern, such as baby talk, but rather the sentence structure and choice of words to use to convey a message. For neonates, using a gentle tone and involving parents in the process helps create a comforting environment. Communicate with parents, but also talk to the baby and respond to voice and touch. Toddlers who are naturally curious can be engaged in the examination process through simple games and distractions. With adolescents, privacy and modesty are paramount, so it's important to respect their personal boundaries and involve them in the discussion separately from their parents. Young adults should be addressed with respect and given autonomy in decision-making regarding their care. Older adults over the age of 65, this is the fastest growing age group, so are seen in the hospital more often. Keep communication simple and factual and ask for feedback. Generation-specific communication will vary depending on the age of your patient. The silent generation was born before 1942. This generation has firm beliefs in good service as they grew up in a time when the customer was considered to be right. Baby boomers are born between the years 1943 and 1960. This generation wants to be engaged in their medical care. They investigate specialists and providers, and many baby boomers are responsible for the medical care of their aging parents as well as their children. Generation X was born between the years 1961 and 1981. This group of individuals are relatively healthy and actively seek information on how to remain healthy. Millennials are born between the ages of 1982 and 1986. These individuals do not use inpatient services unless they have come through an emergency department. They listen to the verbal instructions, but are not as likely to ask questions about their concerns. And Generation Z was born between 1997 and 2012. This will be the smallest part of the population in the healthcare setting because these individuals are of younger age and overall healthy. Radiologic technology programs typically include a course in medical terminology, which all of you have already taken. This equips students with the necessary language skills for their profession, understanding the root words, prefixes, and suffixes, which allow them to decipher the meaning of medical terms. Correct pronunciation is emphasized for effective communication among healthcare professionals, while translating complex terms into simpler language is crucial for interacting with patients. Layman's terms refer to using simple everyday language that can be easily understood by people who are not experts in a particular field. Although abbreviations are introduced in various courses, students may encounter additional abbreviations and symbols in physicians' orders and documentation. For example, DOB stands for date of birth. CHF is an abbreviation for congestive heart failure. ED is an abbreviation for the emergency department. FT stands for follow through. For example, in the program, you guys will learn of a procedure called a small bowel follow through that is abbreviated SBFT. FU is abbreviated as a follow up. XR is an abbreviation for X-ray. A more detailed list of these common medical abbreviations can be found within the Patient Care for Imaging Technology textbook. Standard terminology is used to describe positioning a patient for various examinations and procedures that physicians order for the diagnosis and treatment of injuries or illness. The American Registry of Radiologic Technologists has defined radiographic position and radiographic projection. The radiographic position refers to the position of the body, such as supine, prone, recumbent, erect, or Trendelenburg. These terms refer to the patient's physical position and describe the way the patient is placed to achieve the outcome of a radiographic image. On this slide is an example of the radiographic projections, which is defined as the path of the central ray, or CR, or the X-ray beam. The CR enters and exits the patient before the image is captured, which is the radiographic position. As outlined on this slide, a variety of different positions exist, or projections. So the first image is considered an anterior-posterior projection, where the central ray, or the X-ray beam, is entering the patient anteriorly and exiting the patient posteriorly, as identified by the direction of the arrow. The image in the upper right-hand corner is considered a posterior-anterior projection. The X-ray beam is entering the posterior portion of the patient and exiting the anterior portion. The right lateral projection is where the central ray is entering the patient laterally and exiting on the right side, whereas the left lateral projection is when the central ray enters the right side of the patient and exits the left side. The left posterior oblique projection is when the patient is laying supine and they are rotated at an angle towards their left side. Whereas the right posterior oblique is when the patient is laying supine and they are obliqued at an angle towards the right. The anterior obliques are when the patient is in a prone recumbent position. So the left anterior oblique is when the patient is rolled up and angled towards the left, whereas the right anterior oblique projection is when the patient is prone and rolled up towards the right. Communication is a two-way process. The patient conveys concerns to the radiographer. The radiographer utilizes this information to make the best plan of action to perform the radiographic study. Effective communication is essential alongside with technical proficiency. Developing skills in listening, observing, speaking, and writing is crucial for successful communication. Radiographers should always use critical thinking skills to assess patient interactions objectively and avoiding personal bias. Reflecting on communication outcomes helps improve communication skills. Becoming a skilled communicator requires honest self-analysis of beliefs and biases. Speaking has layers that can convey different meanings to what is actually said or enhance the actual words. Pitch or tone of voice can convey either a finality to a subject or a teasing sense. Writing is documentation, which is absolutely critical. The written message can be accessed by others in the healthcare arena, taking care of the same patient. There is more to communication than just the spoken word. There is the unspoken or nonverbal aspects of communication, and they can be defined as all stimuli other than the spoken word involved in the communication process. For example, seeing. What is the patient doing as he is speaking? And what do you hear? Listen not just to the words, but the tone of the voice. If the patient is felt during communication, what happens? Nonverbal communication, such as body languages and facial expressions, play a role in understanding the patient's feelings and needs. Prospective healthcare workers can glean valuable insights from nonverbal cues such as the body movement, facial expressions, and eye contact, which can indicate emotions, trust levels, and social statuses. Mismatched communications may increase patient anxiety. Patients may not always express their fears verbally, but sensitive radiographers can detect nonverbal signals of anxiety or fear. By using therapeutic communication techniques, radiographers can build trust with patients and encourage them to express their feelings, reducing their fear and anxiety. The radiographer needs to understand cultural differences in communication to avoid misunderstandings. For example, personal space varies from cultures. Additionally, nonverbal cues like nods may have different meanings in different cultures and age groups, so it's safer to just use the spoken language instead of any symbols to prevent and avoid confusion. Humor can also be misunderstood, so it's best to avoid this in any types of situations. Cultural variations can exist within the same country, affecting language and slang. This diversity highlights the importance of clear and respectful communication. Other factors that affect communication include language proficiency. Patients who do not speak English well or English is their second language may struggle to understand medical terminology or instructions, and it may imply incorrect responses. Interpreter services are available at facilities, and an interpreter should never be a family member. Hearing ability. Patients with hearing impairment may require alternative communication methods such as written instructions or sign language, or you may just need to stand in front of them and speak so they can read lips, or stand close enough to an ear that is partially impaired, but do not shout at the patient. Visually impaired patients also require additional help. You may need to give them more instructions for their orientation or their positioning, or you may need to grab their arm and guide them so they do not fall or bump into anything. Patients' cognitive capacity is also different for all. Patients with cognitive limitations may have difficulty processing complex information or following instructions and may require more simplified explanations or to explain the procedure in various segments. Cultural beliefs about medical procedures also varies across different patient populations. Some patients may have cultural beliefs that influence their acceptance or refusal of certain medical procedures or treatments. So it's important for the radiographic technologist to understand the patient's wishes. Gender affects delivery of messages as well. The gender of the communicator and the recipient can influence how a message is perceived or interpreted. Patients may require a specific gender radiographer. Some patients may prefer to communicate with the healthcare provider of a particular gender, and their preferences should be respected whenever this is feasible. Interactions with coworkers also create a dynamic that can impact communication styles and relationships within the workplace. It is also essential to maintain professionalism and refrain from any form of sexual innuendos or inappropriate comments in communication. Lastly, gender-neutral or transgendered individuals. Communication should be inclusive and respectful of all individuals who identify as gender-neutral or transgender, using appropriate language and pronouns. In order to facilitate communication, it is essential to reduce distractors and use simpler language, relying on nonverbal cues like gesture and facial expressions when necessary. For patients using communication devices like an electrolarynx, understanding their unique needs and ensuring the device's safety during the procedure is critical. When dealing with patients with neurological impairments, clear and concise communication, patients and the use of visual aids can help bridge communication gaps. Patients with neurological impairments, such as traumatic brain injuries, may face challenges in communications. Tips for effective communication include the use of clear and concise language. Be patient and allow time for expression. Speak slowly and use pauses. Utilize visuals if needed and ask the patient for their input. Patients that are developmentally impaired may communicate through gestures of body language, and it's essential to engage with them directly, respecting their autonomy, and seeking their permission to involve caregivers in conversations. Communicating with unconscious patients is also vital, as they may still be able to hear and remember conversations. Treat them as if they can hear, explaining the procedure and seeking consent. Altered states of consciousness, whether induced by medical conditions or substances, require simple, direct, and non-judgmental communication, with immediate assistance sought if the patient becomes difficult to manage. Lastly, paralanguage, including speech rate, volume, fluency, and vocal patterns, plays a significant role in communication effectiveness. Using clear and understandable language and avoiding medical jargon and explaining terms when necessary can enhance patients' understanding and cooperation. A variety of therapeutic communication techniques exist to ensure appropriate interaction with a patient from a radiographer. Some of these communication techniques include establishing guidelines, reducing distance, listening, using silence, responding to an underlying message, restating the main idea, reflecting the main idea, seeking and providing clarification, making observations, exploring, validating, and focusing. By reducing physical distance, you maintain a close proximity to the patient to foster inclusion and involvement. By listening, you overcome personal biases and listen without anticipating a response. Using silence or constructive silence allows the patient time to respond. Responding to an underlying message gives the radiographer time to reflect on the patient's feeling to show understanding. By restating or repeating the main idea expressed by the patient, it validates their messages. Seeking and providing clarification if the message is not fully understood. Clarify directions using different terminology if needed. Also, make observations. Verbally express perceived feelings to show empathy and understanding. You can explore by using direct questions related to the patient's problems or to the patient directly and encourage the patient to elaborate their own concerns. By validating, you verify the patient's reported experiences to ensure understanding, and focusing, keeping communication focused on the patient by asking open-ended questions. Redirect conversation back to the patient if the patient has concerns and avoid minimizing their experiences. The last type of communication we're going to discuss is non-therapeutic communication techniques. These techniques block therapeutic communication and include judgmental statements, cliché statements, false reassurance, silence, defending, changing the subject, giving advice, subjective interpretation, disagreeing, probing, and demanding an explanation. Judgmental statements making critical or evaluative comments that can be perceived as disapproving or condemning. Cliché statements are using overused or trite expressions that lack sincerity or genuine empathy. False reassurance is offering insincere or baseless assurances to alleviate anxiety or comfort. Silence is using silence in a way that inhibits communication or fails to provide support. Defending is justifying or explaining one's actions or beliefs rather than just listening empathetically. Changing the subject is redirecting the conversation away from the patient's concerns or feelings. Giving advice is offering guidance or recommendations without fully understanding the patient's situations or needs. Subjective interpretations is interpreting the patient's experiences or feelings based on personal biases or assumptions. Disagreeing is expressing disagreement with the patient's thoughts, feelings, and experiences. Probing is asking intrusive or overly personal questions that may make the patient feel uncomfortable. And demanding an explanation is pressuring the patient to justify or explain their thoughts, feelings, or actions. None of these should be done when communicating with the patient. In summary, clear communication is necessary for successful patient care. It is important that the radiographer properly identify the patient and the procedure being performed. Obtaining a patient history is important and may require different communication techniques to achieve the desired outcome. Patient education is also part of the role as the radiographer in order to ensure successful completion of the procedure. Age, patient generation, and cultural differences are factors that can affect communication between the patient and the radiographer. Verbal and nonverbal communication are essential roles. Therapeutic communication encourages patients to provide answers, and non-therapeutic communication techniques are considered offensive or rude by the patient and can potentially create a closed conversation.